Hello, Thrive Nation. Welcome to another show on the Made to Thrive show. I've got a very special guest. His name is Dr. William Shaw. He's a PhD. He's board certified in clinical chemistry and toxicology. He is the founder of Great Plains Laboratory. He is really an icon in the functional medicine field in the US and abroad. He has international acclaim. It's a privilege to have Dr. Shaw on the show. Welcome.
Oh, yeah, I'm glad to be here, Steve. So, so I've been to South Africa one time, quite a while ago, but it was a short trip because I had another conference coming shortly thereafter, so I really didn't get to see much. I need to come back when I have some more time available.
Well, brilliant. And I know that you've got many friends here, and we're working with a company called Biotics Labs here that is running GPL. And I do want to take a deep dive into the organic acids test and why it's so valuable. And so I'm going to give you a little bit of history on myself. 22 years been in practice in my other life as a physician. I haven't missed a day's work ever in those years. Haven't had Western medicine in probably over 25 years. And I do look after my health. And of course, we've got, signs and symptoms that I do want to discuss as we go through my own organic acids profile. But tell me, a person like myself, why should we do the organic acid test? Just a general overview, Dr. Shaw.
Well, it's because it gives a profile of virtually every organ in the body, and not only each individual organ, but how these organs and tissues interact. So, so many tests talk about the function of one particular thing. The big advantage of the organic acid test is that all of these biochemical systems are interactive. And so the organic acid test not only gives the function of one organ or one tissue, one biochemical system, but also how all these interact. And what you'll find is as you become acquainted with it, you'll become more and more knowledgeable. And so it's like, so even an introductory knowledge will allow you to help with people's health. But as you learn more and more, you'll be able to get the more experience you have, the greater will be your knowledge of how these different biochemical systems interact, and you'll be able to get even more information. So it's very useful for people who have serious illness, ones that are chronic diseases. But it's also very useful for people who just want to maintain their health and just want to optimize their life, their nutrition, their functioning, their how their brain, how their brain can function at the optimum level. So all of these factors are something you can look at with the organic acid test.
Great. Now, I'm not sure about the US. Maybe you can give us a little bit of a history. I know that traditional functional labs here in South Africa are paid by medical insurance. Is this the case for organic acid tests, and where do you see it in the future? Obviously, cost is something that people that are listening in the audience and the viewers on YouTube are going to need to consider, but where is it going to from a reimbursement point of view, OAT?
Well, in the United States, the majority of insurance companies do cover it. The government health plan, Medicare for the disabled and elderly also reimburses for it. But there are some insurance companies that don't reimburse, or some insurance companies that reimburse partially, and then the person has to make a copay. And but there are also many people in the United States and other countries who pay out of pocket.
Okay. All right. So there's a lot of value. So let's have a look at myself in terms of my symptoms. That are not that I have many symptoms. You know, my exercise routine, my environment routine of getting outside and spending a lot of time outdoors. And I had COVID. I think it was a little sinus infection for a day or two. That's all it was, Dr. Shaw. And my immune system's, I think, pretty robust. But I do think this is the next level for to look at my own health and my own performance and my longevity. So one thing I do have from an allergic response is garlic. It is something that I respond to in a really negative way, especially if it's bottled garlic. I can have significant GI distress and vomiting, and I'll be very careful when I eat out. Not that I eat out a lot, but I need to be very careful when I eat out to mention that I cannot tolerate garlic, and that has progressively got worse. So that would be one of the symptoms. Another symptom is a very dry scalp, and in very dry conditions and hot conditions, I can get a little bit of dermatitis and a little bit of what looks like a bit of eczema on my elbows and that. But probably I would look at that as two big symptoms. I'm pretty wake up every single morning. I love Mondays. We've got a little acronym at Made to Thrive, Dr. Shaw. That's TGIM. Thank God it's Monday. So we love Mondays. There's significant purpose that I wake up with on a Monday. And I've run 11 Comrades marathons, which is a 56-mile race that used to be run every single year. So, I've done probably over 35,000 kilometers in the last 25 years of road running. Have get movement 7 days a week. I'm very cognizant of my light diet, the blue light that I get exposed to at night. I'm very cognizant of the electromagnetic radiation about me. So, overall, it's something that I really do take a lot of time, effort, and resources with regards to my health and performance. I don't often lack energy. I don't really suffer with any chronic inflammation or swelling. I think my CRP, most HSCRP is below 0.4. Mostly. So I've done significant functional labs over the years, and I think that's why I want to look at sort of a basic 101 organic acids test profile.
Yeah. It is very worthwhile, and I would say that overall the results are indicative of good overall health. There's probably a few things where there could be some improvements. So one of the things in looking at the test, just to give an overview, is the thing that distinguished Great Plains from many other tests was the research that had been done by me in the field of dysbiosis. So what I found is that the dysbiosis was a major factor in many different illnesses. So absolutely. It was and I started the test working at the Children's Hospital, focusing on genetic disease. But instead, what I saw as we examined children with a wide range of illnesses is that the incidence of genetic disease was fairly low. In most cases, it's like 1 in 10,000. And we did find, because it was a children's hospital, we found some children who did indeed have the genetic diseases, but a much higher percentage, perhaps 50% of all. So that's 1 in 2 children were having problems in which the dysbiosis was an issue. The dysbiosis meaning a dysfunctioning of the microorganisms in the intestinal tract. And so I find that is by far the factor that one of the most common factors that is involved with with illness.
Well, let's talk a bit about dysbiosis. Maybe you can just sort of give a general definition of that. I think, if we look at the microbiome research that's happening in terms of what's happening with, absorption, and obviously this test shows a lot of what's happening from a neurotransmitter and mineral perspective and deficiencies in that. But maybe you can explain to the audience what dysbiosis is, why there's sort of just an exponential increase in dysbiosis. And obviously we've got a gut reset program here, myself as a biohacker and in my other life as a physician. But I think the importance of dysbiosis, speaking to Dr. Stephanie Seneff, I don't know if you know, from who wrote the book Toxic Legacy, who spoke about glyphosate and what's happening to autism rates in the US. In some places like New Jersey, 1 in 20 children is on the ASD spectrum by the age of 12. It's 1 in 55, I think, in the US now. Kids by the age of 12, that are diagnosed on the ASD spectrum, compared to, I think, 1 in 50,000 in the 1950s or something like that. So, dysbiosis, I think, is really important for the people to understand that are listening.
Yeah, so each person has a very large number of microorganisms, primarily bacteria, but other organisms like yeast and molds has a certain amount, and that certain amount is very healthy. It's estimated that the number of bacteria in the healthy intestinal tract is greater than the number of cells in the entire human body. So there's a tremendous number of microorganisms, and these microorganisms are helpful, so they're beneficial. So beneficial microorganisms are often termed probiotics, meaning in favor of biotics, which in favor of life. And these microorganisms are very helpful. They help to crowd out harmful microorganisms that may be there. And if you have a high population of good bacteria, they can crowd out the harmful bacteria. They're also very helpful as far as helping us with the digestion of food. And they're also involved in producing certain essential cofactors like vitamins. So it's estimated that the critical essential vitamin biotin is produced in many people by their intestinal probiotics. And so all of these things are beneficial, and if these organisms are reduced, then our functioning is reduced. And there's a couple of things that are especially harmful, and one of those is antibiotics. So antibiotics, of course, may sometimes be necessary for a severe fatal illness like cholera or something like that. But on the other hand, the use of these antibiotics kills the beneficial bacteria as well as the harmful bacteria. And some of the harmful bacteria are resistant to some of the antibiotics. A good case is that of the many species of the Clostridium genus are resistant to some of the most common antibiotics. And so as the person takes these antibiotics, the harmful bacteria like Clostridia species proliferate, organisms like Candida proliferate since they're resistant to antibiotics, and sometimes mold in the intestine can proliferate as well. So these harmful organisms proliferate. And then the other major factor throughout the world now has to do with the Roundup. The glyphosate is the chemical in Roundup. And of course, there are big lawsuits in the United States because of a a connection between the use or exposure to glyphosate and different types of cancers. And the glyphosate also acts as like antibiotics do in killing beneficial bacteria, the probiotics, but many of the pathogenic bacteria are resistant. So as people eat these genetically modified foods that are sprayed with Roundup, the more they eat of these, the more they're harming their intestinal flora. And I think this is one of the major factors in autism, and I've published a paper showing high amounts of glyphosate and triplets that all had severe neurologic symptoms, and two of them had autism. And by getting rid of the genetically modified food, which in their case was corn, they had a significant improvement in their autistic symptoms. And they also had a significant reduction in their problem with Clostridium, which is one of the bacteria very common in autism.
Sure, thank you for that summary. And I think how important it is, and we're going to get into this, to eat organic food as much as you can because of this glyphosate problem. It's all over the shelves in South Africa. It's used on the crops. There's no legislation whatsoever when it comes to glyphosate in South Africa and beyond. So I do think it's a problem that we're facing in Africa for those people listening. So Dr. Shaw, thank you. Can we go through my organic acids test and have a look
Sure.
at the things that we need
Sure.
to address? And also let's look at it through the frame of a few things: nutrition, environment, a movement or exercise, sleep, and then the last is self-quantification. Those are the 5 pillars that are ones that we can intervene. I think with regards to the physiology and the biochemistry, we do have another 2 pillars in purpose and community. But let's focus on those 5 pillars as we address some of the deficiencies and excesses, and see what are the actionable steps that someone like myself and then people that are going to be doing the organic acid test can then implement.
Yeah, would you like me to show it on the screen?
If you can, I'm going to allow you to share then. So then, there we go. So everybody can now.
And let me find a, okay.
Great.
So in looking at this, so each one has the patient's value and then the reference range, which is based on a significant number of people. And we have 4 major divisions, which are male and female, and then adult and child. We're actually, some of the biggest variations are in children, so we'll probably in the future also divide this into more age groups in children. Right now, we just have a single child's group, but in children, the values do change considerably with age, and so the future will have more divisions for the normal ranges.
Dr. Shaw, I'm going to just stop you there because I just know from functional medicine, the ranges are quite broad. I'm not sure how it works, the organic acids test, but for example, if we look at TSH, thyroid stimulating hormone, the range goes from 0.5 to 3.5. And for me, those ranges are way too wide. And a lot of people will see a traditional medical doctor and, the TSH will be 3.2, but the patient has significant, signs and symptoms of hypothyroidism. How does your reference range work? I mean, as we go through this,
Well, I mean, it's just based on people who are essentially normal. And we've asked them to fill out a questionnaire, making sure they don't have any major diseases, they don't have seizures, they don't have attention deficit, they don't, that they there's no significant disease. Of course, that doesn't mean they're in necessarily in optimum health, but it does mean that they don't have any significant illness. But what we find is that that in some cases, people who are in the normal range, but who are near the end of the normal range may have some pathology. And so in our interpretations, we make note of that. For example, in neurotransmitters, a neurotransmitter may be in the normal range, but on the extreme low end, and we'll make note of that, that the person might want to consider that there is a problem going on. But as far as the flags go, these red letters for H or L, those are based purely about whether the patient's value is in the normal range. So, so for example, in your case, the arabinose, a marker for candida, is slightly elevated, and typically this might be from somewhat more carbohydrate or sugars in the diet, but it could also be due to other factors, like there could be a deficiency of the IgA antibody, the immunoglobulin A, which is coats the intestinal tract and the mouth and in the tears. I think if I was advising someone, I would say I wouldn't necessarily say that this value would require treatment. The hippuric acid is elevated, but again, this is a number 10. This is primarily due to beneficial bacteria, and it just indicates there are probably more bacteria than average in the intestinal tract. Again, a value that does not require any intervention. Number 14 is significant because this is the marker for beneficial bacteria, and it's higher than usual, which is beneficial. The fact that there's more beneficial bacteria present, and then the ones that are most problematic are in the Clostridia family, and they're all in the normal range, with cresol being a little bit higher than average, but still not enough to warrant any kind of intervention.
Okay, let's stop there. So you would see significant problems with someone who's, has dysbiosis if regards those, the HP, HPA, the cresol, those would be significantly higher if someone has had dysbiosis.
And one of the highest values I've seen were in people with severe autism and in schizophrenia. Those are the conditions which I've seen some of the highest value, but I've seen it in people with a wide variety of illnesses. So it's not only the mental illnesses, but it can also be, for example, I saw very high values in a person with severe seizures. I saw very high values in a patient with severe ulcerative colitis. As a matter of fact, it was so severe that the gastroenterologist recommended they remove the intestinal tract, which is very unfortunate because this could have been treated with just simple potent probiotics. Instead, the person had a large part of their colon removed. I mean, really completely unneeded. And so it's very sad that I had talked to the father of a child with autism with severe ulcerative colitis, and he had just had the surgery a week or two earlier. And I said, it's unfortunate we didn't have a conversation a couple of weeks ago because it was really absolutely unneeded.
Yeah. Let's talk about Aspergillus here. These here, obviously, I'm all in the range here, the tartaric. If those would be elevated with someone with yeast and fungal, increase, what numbers would you see there firstly, and what would be the intervention?
Oh, so these markers are associated with people who have mold exposure. So if their house, their school, their office has mold, which is one of the microorganisms that's even mentioned in the Bible, in the Old Testament. There's several pages of the Bible that talk about how to determine if your house has mold, and you have to call the rabbi to come to your house and inspect it. And if it continues, you have to take away all the materials in the house and throw it into the garbage dump. So there's a whole section of in the Leviticus in the Old Testament. And the mold is a major, so it can be in your office, can be in your car, in your house, and it could be the person gets it from working even in the garden. There could be, if there's an excessive mold, the person could get have the intestinal tract colonized with mold. And another way that people get it would be a suppression of the immune system. So for example, it's very common for people who have chemotherapy to develop systemic mold infections. And matter of fact, it's so common that in one of the hospitals where I worked, they routinely gave people antifungal drugs whenever they were administering chemotherapy, because the chemotherapy disrupts the immune system, and so the person, even if they only have a small amount of mold, it may proliferate due to the impaired immunity. So those are two major things. And of course, the person may have a genetic deficiency of the immune system itself, and that could lead to mold overgrowth. So the mold is, the greatest number will be in the intestinal tract. But in talking to a colleague of mine, a otolaryngologist, which means the ears, nose, and throat doctor, he found a patient who had severe sinus problems. He did x-rays of the sinuses and found large stalactites, the structures that you find in underground caves, were present in the sinuses of the person, and these were formed by oxalates that were produced by the mold growing in the person's sinuses. And once he gave the person antifungal treatment, these stalactites in the sinuses completely cleared up.
Great. Let's talk about antifungals. Are we talking pharmaceutical drugs? What would they be, number one? And number two, are there natural herbal alternatives for the antifungal? And then I suppose, just to mention anyone listening there and the viewers, this is not medical advice. Please consult your medical practitioner before taking any type of remediation at all.
Yes, so there's a wide range of treatments for yeast and fungi. There are many over-the-counter products that do not require prescription, and of course the prescription requirement varies from country to country, and so some countries would require prescription antifungals be approved by a physician, and some countries would not. So I don't know what the situation is in South Africa. So So some of the common prescription antifungals are nystatin, amphotericin B, diflucan, which is also diflucan is what is called a systemic antifungal drug, meaning that if you have fungi inside the cells of your body, you could need a systemic antifungal compared to nystatin, which only kills the yeast or fungus in the intestinal tract. So it's not, nystatin is not absorbed from the intestinal tract, so only kills organisms found in the intestinal tract, whereas diflucan is an antifungal drug that will be absorbed from the intestinal tract and can kill yeast or fungus in different parts of the body. And some of the other ones are Sporanox is the brand name, and the generic name is itraconazole. Those are very useful for mold. So mold is somewhat difficult to treat, and those have been some of the more potent drugs for treating problems with mold. And recently, Dr. Sidney Baker and I published a paper on a child with autism who had a complete recovery following treatment for his Aspergillus. So these markers you see here, 2, 4, 5, and 6 were elevated, indicating a overgrowth of mold or fungus in the intestinal tract. And after a couple of months, all his symptoms of autism were reversed. And even now, years later, he still has no further symptoms of autism. And of course, I want to emphasize that each one of these are subgroups, that autism is not a single illness. It is a multifactorial illness. And so that doesn't mean that every child with autism has this problem, but there are many that do. A recent study indicated about 1/5 of the children with autism have a significant problem with the mold toxins.
Okay, what about autoimmune diseases, Dr. Shaw? Do you find a lot of patients, I mean, there's just been an exponential increase of lupus, rheumatoid arthritis, Sjogren's syndrome?
Yes. So, so all of these autoimmune diseases can be triggered by mold problems. There was a study in one of the Scandinavian countries showing marked increase in autoimmune diseases among the teachers in schools that had significant mold problem. So mold can be a significant trigger for autoimmunity, but so can toxic chemicals. So in places where there was oil spills, for example, it was found there were high amounts of autoimmune disease in patients who lived in those areas.
Tell me a little bit about hydrogen peroxide, probably IV or hydrogen peroxide as nebulization through the sinuses, which I found very beneficial. The use of ozone. I was trained by the American Association of Ozone Therapy by Frank Schellenberger. The use of ozone when it comes firstly to Aspergillus and maybe looking at the Clostridia bacterial markers. But would those be some significant interventions?
Sure. Yes. Yeah, those would be. So the peroxide is something that is can be used for treating some of these microorganisms, including the mold, and as well as the ozone, and there are many over-the-counter herbal remedies. For example, the medium chain triglycerides or coconut oil are very useful antifungal types of compounds, and they're also products that were found in the rainforest that have antifungal treatment. So there's a wide range of both pharmaceutical drugs as well as one that don't require prescription that can be used as antifungals. The only difficulty I would say is there's probably not as much published information on the use of some of the non-prescription agents, and it's purely because the pharmaceutical companies, of course, encourage publication and so forth. So there's a lot of times many more scientific articles in the medical literature.
Who are you a clinician? Do you see patients, or who would be the primary clinician that we could have on the show to discuss all the varied treatment options and what's being beneficial for certain parts of the organic acid tests, you know, from the hydrogen peroxides to the ozones to the herbal remedies?
I know there are many people that use that. I myself am not as familiar with that, other than the fact that I know there are many physicians who do use those compounds. And the other thing to remember is, like, for the Clostridia bacteria, they're anaerobic organisms, so they die in the presence of oxygen. So some people have even used hyperbaric oxygen treatment as to reduce the Clostridia, for example, since oxygen is actually toxic to the Clostridia bacteria.
But Dr. Shaw, as we're speaking, it almost seems this test is an absolute necessity for every single person. If you're looking at mold, you know, if you're looking at C. diff and what's happening there in the Clostridia and what's happening to our environments now, this would be sort of paramount for almost every single person to do.
Yes, yeah. I mean, there's so many applications for this test. I think I did a summary just looking at in the United States, you have to give a tentative diagnosis code to submit the test to insurance. And I think there were over 600 different diagnoses in which the organic acid test was being used. So
tell me now,
everything under the sun. So people with autoimmune disease, people with chronic fatigue syndrome, people with fertility issues. So all of these huge array of illnesses. So all of the psychiatric disease, every single one is, in my book, has been associated with the problems with the dysbiosis. So it includes autism, attention deficit, depression, psychosis, even the eating disorders, anorexia nervosa. So what I found is a number of cases in which the woman with anorexia nervosa had huge amounts of the dysbiosis. my theory is that the reason for not eating was just the fact that with the person who has the very severe dysbiosis, some of the foods can actually cause a greater problem in the GI tract. So the person is really reacting to their severe dysbiosis by withholding food with probably indirectly hoping to starve out the harmful organisms in the intestinal tract.
So I've got a 17-year-old and a 5-year-old, Dr. Shaw. When do I do their first OAT test?
So we've done this a lot of times on children who are newborns. And we've also done people who are 100 years old. So there really is the only challenge is getting a urine sample. So I would say anytime you have something that doesn't seem right, the organic acid may be able to assist in a very useful way. And of course, a whole range of genetic diseases has been, the organic acid has been very useful. As a matter of fact, those genetic diseases were the first application of organic acid testing.
Right. So let's move to Clostridia. If these numbers were at what numbers would we be concerned, and what would be the interventions if they were higher than they are?
So the higher they are, the worse. So far, I have not found that low values are significant. In other words, it's probably the lower the better. But the ones here in the middle are not any ones that I'd be concerned about. I would be concerned. I have seen some symptoms develop near the upper limit of normal. So this represents the upper limit of normal. The bar on the right, that is the upper limit of normal. The pinkish area is like the mean plus or minus 1 standard deviation. And so ones that go all the way to the end of the bar, the people would start to have some symptoms, and the most common symptoms would be some gastrointestinal problems would begin to pop up, and then the higher the values, the more severe. And then I'd like to go to and a way of assessing the damage is to look at the neurotransmitters, because high Clostridia bacteria cause a problem with the neurotransmitters. And so stop right here. Yeah. And so the most important value for looking at the Clostridia is this HVA-VMA ratio. So if this HVA-VMA ratio exceeds the limits of normal, so if it's greater than 1.4, the most common reason is because the person has excessive Clostridia bacteria. And occasionally a person may have this high ratio without the Clostridia bacteria. And this is most commonly due to a genetic disorder in the enzyme that converts dopamine to norepinephrine. Matter of fact, there's a diagram of that on the O test. Yeah, there it is, right there. Yeah, so you can see that if you put your pointer, I don't think my pointer can be seen, can it?
No, mine can't.
No, so put your pointer on dopamine.
Yeah.
And so the dopamine, the arrow going down, dopamine's converted to norepinephrine, and that enzyme is dopamine beta hydroxylase. So
it can be caused by copper deficiency or vitamin C deficiency, but usually is not, because you have to get to extremely low copper or vitamin C deficiency before this enzyme doesn't function. It can happen, but the most common reason besides the Clostridia is genetic deficiency. And this is a fairly common genetic deficiency. Perhaps even 10% of the population may have one of these deficiencies, which usually is not a complete one. It's usually one of these called SNPs, the single nucleotide polymorphisms that somewhat affects the enzyme, but doesn't completely delete all activity of the enzyme. And so, so many people with this genetic deficiency have also been found using the organic acid test. In effect, it is like a, you might say a poor man's test, DNA test, and that some of the more common genetic diseases can be determined along with many other things. So the organic acid test, I would say, is, we have a phrase, more bang for the buck, meaning it is highly economical because you get multiple different tests that have relationships, you know, for a good price, considering all the technology that goes into this. And let's go back to the neurotransmitters again, Stephen.
Sure.
Yeah. So so if this ratio, number 35, the HVA-VMA ratio, exceeds the upper limit of normal, there's significant problems. I've seen kids with, so you see the average value is around, the mean value is around 1, but I've seen some kids with autism who had values of like 50.
Wow.
And so there can be extremely high values, and it can be due to the Clostridia, as I mentioned, or the genetic deficiency of the dopamine enzyme, or the worst case scenario, the person could have both things simultaneously. We also have indicators for the problems in the conversion of dopamine, which can be due to a deficiency of SAMe, the S-adenosylmethionine. The DOPAC, the number 36, can be elevated. We have a marker number 38 for the serotonin, so lower values. And so I'd say, based on this, I would say you might want to be taking some HTP if you have any issue with sleep, for example. This would be, you might want to increase this. One thing I want to point out is, do not use tryptophan, because tryptophan can go in 2 directions. And one direction is to form quinolinic acid that can cause severe inflammation. So I had just a consultation yesterday in which the patient was getting tryptophan instead of 5-hydroxytryptophan. So they're very similar, but the tryptophan can form quinolinic acid, which can cause inflammation in the body, but also inflammation in the brain. And so your value is very nice, but the patient who was taking tryptophan had excessive amount. I think the value was around 4, which was like double the upper limit of normal. And so the advice was to change the supplement from tryptophan
to 5-hydroxytryptophan.
Great. Now, how would, if that ratio, that HbA-VMA ratio was like above 4, what symptoms, you said the etiology would probably be from, overgrowth or too much of Clostridia, but what
Right.
symptoms?
So the symptoms of either the genetic disorder or the Clostridia are virtually identical because they're affecting the same biochemical pathway. And so the symptoms would include virtually every neurologic and psychiatric disease, ADD, autism, depression, Alzheimer's disease. A common symptom is dizziness and fainting. In children, bedwetting is a common symptom, so if the problem is the Clostridia, it can be treated with just simple probiotics.
Which probiotics, Doc?
The best are the ones that are the Bacillus species. The soil-based probiotics are the best for all of these Clostridia, 15, 16, 17, 18. You can use the same probiotic. One product is called Core Biotics. So CORE Biotics, and it is several different species of Bacillus species that are listed as generally recognized as safe by the Food and Drug Administration of the United States. And I've taken them, I've given them to family members, and they're extremely effective in the control of Clostridium. Unfortunately, if the problem is genetic, at this time, there is only a pharmaceutical therapy available for if the person has the elevated HbA-VMA ratio, they have to get a drug called droxidopa. In the past, it was very expensive, but now there's about 5 or 6 pharmaceutical companies that have produced generic, and so the price is plummeting.
Okay.
And
right.
the spelling of the drug, again, it's called droxidopa, DROXIDOPA, and people have had very good results. People who were so another one of the symptoms is extreme fatigue, unable to exercise, and a person who had all these symptoms could not walk more than a block, was able to run a marathon after treatment with the pharmaceutical.
Now, Dr. Schwab, I want to just maybe speak about probiotics because it's such a contentious issue. There's so many different opinions out there on taking regular probiotics, if you should have probiotic diversification or diversity, having a microbial, diverse microbiota, alternating. We've got many probiotics, so we use many different companies, Metagenics, which I'm sure is there, Zymogen, a lot of these products, probiotics, but then there's also the view of spore biotics, only taking spore biotics. What is your view on continuous use of probiotics?
The only thing I know is that the Clostridia bacteria is one that's very difficult to get rid of. I mean, it's so difficult that some of the people resort to the fecal transplants. But this is one avenue. But if you have a fecal transplant, you have to have a donor who is disease free. What if so you have to? So it's very elaborate. You have to make sure that the person doesn't have hepatitis or HIV or other very harmful illnesses. And I think it has potential. But my experience has been that these spore producing probiotics, which are sometimes also called soil-based probiotics, have been extremely effective, and I haven't seen any significant side effects. And I know people who've given them to their child with autism, and a child who had continuing Clostridia problems, but once the probiotic was the soil-based organism, it completely cleared up the Clostridia problem, which the child had had for years and years.
Wow.
And so the regular lactobacillus species will work to some degree, but they're, in my experience, they're just not nearly as potent as these soil-based probiotics.
Right. And tell me, does this Clostridia, is it in the small intestine, the large intestine, in the gut itself? Because obviously we want to look at, and maybe we won't, maybe that's part 2 to look at SIBO, but where are the Clostridia sort of?
The Clostridia may be, are probably predominantly in the large intestine, but but may also appear in the small intestine as well. And as a matter of fact, number 15, that marker is sometimes the 4-hydroxyphenylacetic has been associated with SIBO. There may not be as much in the small intestine as the large intestine because of the oxygen factor. They're probably the further down the intestinal tract you go, the less oxygen. So the colon usually has the least oxygen of the entire intestinal tract. And that's why the Clostridia are maybe more prevalent there. But I feel very strongly that they're also can maybe present in the small intestine as well. The organic acid test cannot differentiate the location, but in some ways it doesn't need to, because whether it's in your large intestine or small intestine, the treatment can be the same, which is using an effective probiotic. There are pharmaceutical treatments, but overall they're much more expensive, and to my mind, they have more side effects and are less effective for long-term treatment. And in the past, I used to recommend some of the specific antibiotics, but I don't recommend those as much anymore.
Right. Okay, Dr. Shaw, should we move on? I think let's look at the next.
Let's consider the oxalates right at the top of the page. So so your oxalate is somewhat high, and so the two major factors for this would be diet and mold, and so you would need to make sure there's no mold in your environment, and then there's another factor which is somewhat controversial, is that some foods are exceptionally high in oxalates, and 2 of them especially are so high that I don't recommend, which are spinach and soy. As a matter of fact, there was a famous experiment done by the soup company, that is the predominant soup company in the United States is called Campbell's. They did a very large study on rats in which they gave them, they wanted to see what was the best nutritional soup, and they evaluated rats, and they evaluated different vegetables, and they found that if they gave the rats high amount of spinach, it caused increased mortality, increased rates of infertility, and many other problems. And so even though spinach has some calcium, the amount of oxalate exceeds the amount of calcium. And I've talked to numerous people who were eating very large amounts of spinach salad every day, who ended up with kidney stones. So oxalate stones can cause kidney stones, but they can also cause pathology of virtually every other organ in the body, the eyes, the brain, the muscles. So more than likely, the high oxalate is one of the main causes of fibromyalgia. So these oxalate crystals can become very large, and they can become sharp. And so if they form in the muscles, every time you move your muscles, you're in effect cutting into these crystals are cutting the muscle fibers and causing pain. So I know a number of cases in which getting rid of high oxalate food was very effective in treating fibromyalgia. Do you use that word, or sometimes in the British countries they use another term for fibromyalgia, something like?
We use fibromyalgia, but I'm just thinking, is this the same narrative and continuum as Dr. Stephen Gundry's work, the plant paradox of high oxalic acid, and what it does to almost bring on or be a cause for autoimmune diseases, chronic inflammation, chronic.
Yeah. So all of these can be due to the high oxalic acid. And so I got into a very heated debate with the people promoting that was called it's a fad that's still going on, the green smoothie. Yeah. And the green smoothie was a drink in which they used a lot of spinach. And I strongly suggested that if people want a vegetable drink, they substitute other vegetables like broccoli or lettuce that are not high oxalate foods.
Okay, so how do we remediate this? I'm not having a lot of spinach, Dr. Shaw, so I don't think I've got mold. Not that I've checked, but it doesn't seem like the rest of my organic acid tests.
So there's some other foods that could be high in the diet. So the big ones are the chocolate and nuts. So virtually all the nuts, peanuts, almonds, and so if that was excessive, that could be an issue. And there also is some possibility it could even be genetic, so people have, so it's a very complicated marker. You just need to see, if you have any of the foods, are you eating an excessive amount of the foods that are, very high in oxalates? If not, then look at the mold. And if not that, then it possibly could be genetics, in which case increasing vitamin B6 can be very helpful. So you could try increasing your vitamin B6 to 100 milligrams a day, and then see if that value declines. If it could, that could be a genetic factor. And if we could go back to the graph, right? Just let's see. Oh no, the one of the Krebs cycle. Yeah. So you can see here in the center, if in the very center of the Krebs cycle, you see the marker glyoxylate, and so that's one that many people will have. And if you have enough vitamin B6, you see the glyoxylate is converted to glycine, which is relatively harmless. But if you don't have enough B6, then the glyoxylate is converted to oxalate, which is that red arrow going up.
Okay, sounds good. I do have a lot of nuts every single day because I keep my I do, I get rid of the phytic acid in that, and I do prepare them myself, but I'm still having
But
at
it's
least.
good. The nuts actually have the oxalate, and so what you could do is try the extra B6 and see if that reduces the oxalate. If not, you might want to consider just somewhat reducing the amount of nuts.
I do take glycine after speaking to Dr. Stephanie Seneff and glyphosate and its impact and how it impacts, the receptor site, and suggesting 4 grams of glycine a day, twice a day at least. Looking at the Krebs cycle here, do you think that's relevant in terms of trying to, remediate against excessive glyphosate? That's a
good question. I would have to review, but I think this is a reversible reaction. I think the B6 would be increasing the B6. 100 milligrams is a good amount for an adult, which almost never causes side effects from the B6. And I think I would be in favor of that, because the glycine might reverse that reaction, could reverse and then form more glyoxylate and oxalate. I'm just not completely sure.
Great. Okay. Good. So I've got to deal with that, and that also could give, after my exercise, a sort of a jointy feel and a sort of a stiff lumbar feel that I sometimes, obviously I'm doing a lot of exercise, so you don't know if it's from the oxidative stress and just from the, the microinflammation.
I would suspect that that the oxalate could be the main culprit, because what I found is even the smallest amount of even people with who are just high normal with the oxalate may have some symptoms.
Okay.
So I would bet that joint discomfort or muscle discomfort might be due to the oxalate. It's somewhat excess.
Right. What about detox mechanisms like infrared sauna? Now that we're talking about oxalates, we're talking about Clostridia, Aspergillus. How important is the detox mechanism of infrared sauna and other mechanisms to detox?
Yeah. So with oxalate, the best thing is just to reduce the amount going in the diet, and then the B6 to prevent the body from, because the body can make more from the cofactors, and then also taking supplements of calcium and magnesium citrate. That so you may find that maybe if you took several hundred milligrams of that a day, maybe you wouldn't even have to reduce your the amount of nuts in your diet, because it will prevent the calcium and magnesium citrate, prevents the absorption of oxalate from the gastrointestinal tract. Okay. So that would be another way that you could reduce the absorption of oxalates. And what will happen is, as you reduce the amount in your body, even if you have these crystals, they will start to dissolve and dissolve again into the bloodstream, and then be excreted into the urine. Okay. So the best way for detoxification is just to reduce the intake, and then the body will start automatically dissolving and excreting these into the urine.
Great, wow. And I can just see, Dr. Shaw, how complicated this is, how many factors there are. And
it is. It's one of the most complicated factors, and almost no. And so you read medical books by kidney specialists, and they only focus, their only focus is on the genetic aspect, which is a relatively small portion. It's much more associated with
dietary intake, vitamin deficiency. It can also be due to people with have candida. The candida also produce oxalates, and the mold as well. So all of these organisms can play a role. So it's a very complicated path, which is one of the benefits of the organic acid test. So if you go, so there's a marker for vitamin B6 that's in the vitamin section. If you want to go ahead, there it is. Yeah. So yours is, it's not in harmful, but it could be, it's not extreme deficiency, but the value could be higher. And so supplementation with B6 could be helpful. What I see is that a lot of people who have really severe oxalate problems may have the vitamin B6 marker near zero, so it is one of the more common vitamin deficiencies.
Okay, right.
And then just looking up, I'm going to jump up. The 48 and 49 are markers that are associated sometimes with deficiency of carnitine. And as a person who exercises a lot, you'll be, your body will be breaking down fats to supply energy. You look like you're a pretty lean person from what I see here. And so it's because you're burning a lot of fat and so my suggestion, you might want to add carnitine supplementation to your nutrition regimen, because it helps in the oxidation of fatty acids that you need as an athlete.
Okay, good. All right, so where do you want to go now? I think we've finished, I think Candida is so we finished yeast and fungal, the bacterial markers is Clostridia. I know we've gone a bit over time. Anything else? The oxalates we've spoken about, mitochondrial markers.
So mitochondrial markers, so you're fine on the mitochondrial markers in the Krebs cycle. One of the best markers is succinic acid. So when the person has toxic chemical exposure, which is very common, and so if the value of succinic acid is high, it's because the mitochondria are not functioning well. And the most common reason is because of toxic chemical exposure: mercury, lead, the weed killer 2,4-D. All of these are chemicals that affect the Krebs cycle. There are also people who have, genetic disorders of the mitochondria can also have elevations, but the toxic chemical exposure is a much more common factor in what's going on. And just to let you know, I'm getting a message. I've got 15 minutes, or if you think I know we're already over time, but do you think this would be a good time to close, or do you want to go over another? But I've got the most 15 minutes before another meeting.
I think maybe can we just sort of make this as part one? Would that be an option to come back and discuss?
Now let's do that, because we've covered a lot of territory today.
And then we can have a look at the rest and sort of unpick that. That would be incredible. I know your time is so valuable, but I think the audience and the community in South Africa is going to gain a lot, and especially the organic acid test here in South Africa is well priced, even with sending it. It's easy to do. If I just think it's not a blood drawn test, it's just a urine test. So children, adults, anyone can do it. So I think
and by the way, we have for children who aren't toilet trained yet, we have these genital tape-on bags. So they just put it in their child's diaper at night, and the urine can. So we have special kits for those who indicate their child is not toilet trained. So like I say, we can go all the way from newborns to elderly people in their hundreds can all benefit from this testing.
Well, some people might only get to part one. We've gone deep dive into the weeds here. So let us just finish, Dr. Shaw. If we look at the organic acids test, what can people do? Give us your top 3 hacks, pieces of advice that people can implement with regards to, the organic acids test and ensuring things like Clostridium, ensuring things like, looking at we did from the Aspergillus side, the neurotransmitter side. What can people do?
Yeah, so so one of the most important things that I would say is this particular test has been extremely useful for people who think they've done a lot of medical tests and treatment, but still don't have good health. So if they've gone 3 months, or if they've gone 6 months or more, and they're going from one doctor to the other, and they're not getting the health that they want, they should consider they need to do something more comprehensive. And the organic acid test is one of the most comprehensive tests that there are for looking at anybody who's had a chronic illness that's persisted too long, or somebody, maybe it's not a chronic illness, but it's a very severe illness. Like one of the things we've seen is amyotrophic lateral sclerosis. We've seen significant abnormalities in the organic acid test that I suspect might be able to be treated. So ALS is considered an incurable disease. But I am not sure that it's true. So always question medical authority. Don't always take a medical authority without some doubt. And so always look for new possibilities that might be something that could be a significant asset to your health.
Right. 2 other things just from nutrition or exercise or checking your house for mold, what would be or sleep, what would be 2 other pieces of important advice?
Yeah. Well, sleep is an extremely important factor in health. Virtually everyone recommends 8 hours. And there are even studies done to show that the athletes who got an extra hour of sleep were much more proficient athletes. Their basketball percentages and the goals they scored were better when they had adequate sleep. And so they're all very important aspects. Your nutrition is extremely important, that you get all the vitamins, minerals, and proteins you need for your health. Again, the organic acid test can give you insight into whether there's any problems with those things going on.
And what about organic meat and organic vegetables? How important is that compared to traditional, conventional?
So a large part of our fruits and vegetables are contaminated, and of course, many of our meat animals are being fed these contaminated foods, and so that the foods themselves may be contaminated with these weed killers. And so eating the highest quality food is an extremely important factor in health.
Well, Dr. Shaw, you're a pioneer, you're a health legend, incredible learning experience that I'm going through over the last year through this organic acid test. I wish you well. I thank you so much for your insight, your time. I can see you're a man who wants to see people healthy and well and transform people's lives. And I'm sure you've seen miraculous things happen as you've unpacked this organic acid test and then given the interventions to patients and clients all over the world. So thank you so much. And I'm looking forward to part 2. Hopefully we can set that up pretty soon.
Yeah, thank you very much for the opportunity and the opportunity to speak to your fellow citizens. Thank you, Steve.
Right.